All I could think was, I can't afford to be sick. I have to be able to finish my degree. And so the prospect of something being wrong with me was very scary, especially something that didn't go away. My name is Keisha. I was diagnosed with MS when I was 19 years old in 2008. There was an event that was to raise money for MS. It was raising money for the MS Society. I got involved simply because the fundraising event itself was fun. I think I can speak on behalf of, all of my friends that we didn't see it as something that really was going to be close to us. We were helping people who were probably older and definitely weren't connected to us. I was diagnosed by the following January. I remember being very scared about the prospect of, do I need to change my whole life now? With every DMT that I've taken, there has been difficulty with getting things approved by the insurance, figuring out how much you actually have to pay versus what you think you might have to pay. It's really hard that I know I'm gonna suffer, and yet there are certain systems that you have to go through that don't work for anyone that I know with MS. Step therapy, basically having to have a medicine fail before you move on to the next one, has been really frustrating because I almost feel like I'm always setting myself up and my body up for failure. I've had too many relapses that I think didn't need to happen. I'm thankful that I have insurance and therefore I'm able to afford some of these medications that I would never be able to afford without. Every year, my employer has to choose what health plans to offer. And I worry every year that the numbers that come along with that plan are going to be too much for me.
The cost can just be exorbitant sometimes. We try to be very needs-based and go on what we need for our family, and taking less trips or doing less things that are focused on, fun needs.
Policymakers should do something about lowering the cost of MS medicine. I think that when medicine is as expensive as it is, we're reducing the likelihood that everyone's going to be able to make it on their own.